Hey, Coach Adrienne here with Moving Forward with Diabetes Management. Thank you so much for coming in and enjoying this video. Today we're going to talk about pre-diabetes and the risk factors associated with that. Pre-diabetes risk factors includes a multitude, so many different things that makes you at higher risk for having the diagnosis of pre-diabetes. And as we've talked about in other videos, pre-diabetes is when you actually have a medical diagnosis where your blood sugars are elevated. They're higher than what they should be. And with the diagnosis of pre-diabetes, there are different risk factors that's associated with this medical condition. So we're going to get started with the first one. The first medical condition as far as a risk factor with pre-diabetes is being overweight. Yes, according to your height and also your weight, we have a number called BMI, which is your body mass index. And based on your BMI, that's how you're classified as overweight or obese or morbidly obese. There are different classifications based on your height and your weight. So if you're overweight, that means you actually have excess body weight that puts you at higher risk for having the diagnosis of prediabetes, which just means you're at higher weight, and that puts you at higher risk for prediabetes, which also unfortunately puts you at a higher rate and risk for other conditions such as heart attack, stroke, and other different medical conditions associated with being overweight. Now, one thing, of course, that we can always talk about is if you're overweight or obese or morbidly obese is to lose weight. But we also know that there are other barriers or other obstacles that may be in place if you're overweight. So based on your activity level, based on how much you can move or your duration, your physical activity has to be tailored for what you need to do for your particular activity that you can do for at that time. And because we always want you to be safe. So you need to always talk to your medical provider before starting any type of medical activity, any type of exercise, anything that's going to put you at an increased endurance to maintain that particular activity. So being overweight is one risk factor for prediabetes. Also your race. So if you're African American, Asian American, Hispanic, Latino, these are just a few of the races that put you at higher risk for developing prediabetes and also other types of diabetes such as type 2 diabetes. Although when we talk about race is something that's not modifiable. So that means that we cannot change our race. So race being a factor as a risk factor for prediabetes and also your weight. So when we talk about our weight and we talk about non-modifiable versus modifiable, these two words have significant meaning because for some things, such as our race, we can't change our race. But your weight, depending on what activity, what movement, what exercises you actually can do, your weight can be changed by setting goals, by talking to your medical provider about what activities are appropriate for you and that you can tolerate. Your weight is something that's modifiable or something that you can change. Now, when we think about prediabetes, we also think about being physically active less than 3 times a week. So just like we already talked about, weight is something that we can change by setting goals and also trying to lose weight. But if we're physically inactive if you're physically active for less than 3 days per week, that's something we need to look at. Because if you're not active at least 3 days or more, we need to look at your activity level. Now, first, we need to also talk to our medical provider to see if you can tolerate it. But if you're physically active less than 3 days a week, that has not only something we need to look at or has an effect on our weight, it also has an effect on how well our heart and our lungs are going to be working. Because when we do what we call aerobic activity, such as walking or jumping or something that includes our need of oxygen, such as playing basketball or swimming, something that needs continuous oxygen for us to do, that is actually going to help us over the long term. Not only with our pre-diabetes management, it's going to help you with your lifestyle management and lifestyle changes overall, because it's going to help you with your weight management. It's going to help you with your lifestyle management, because now you're actually moving, you're grooving, you're doing all those things that you need to do to be proactive in your pre-diabetes management journey. So just to recap, some of the risk factors for pre-diabetes are being overweight, physically active less than 3 times a week, also your race. We talked about modifiable versus non-modifiable. Now with your race, we can't change that, but definitely with our weight and being physically active less than 3 weeks, those are things that we can change. And with the guidance from your medical team and them letting you know what you actually can do for physical activity, those are things that we can work on, set goals towards, and work on each time. Now, another thing that we cannot change is gestational diabetes. Now, for our ladies that have become pregnant and they've been diagnosed with gestational diabetes is a condition where when you're pregnant, the diabetes is diagnosed. So with gestational diabetes, some of the ladies may actually have babies that are larger than 9 pounds. And then also with gestational diabetes, this puts them at higher risk for having, in the future, having or developing type 2 diabetes. So all of these different things go hand in hand with being a risk factor for prediabetes. Overweight, physically active less than 3 times a week, having a history of gestational diabetes, your race. These are all things that we have to think about when we look at prediabetes and the risk factors. So, one of the things that we do talk about in our program, moving forward with diabetes management, is we offer a 12-week course, Take Charge and Balance. Yes, we offer this course virtually via Zoom. It's a group session, a community session, where we meet each week for 12 weeks via Zoom, comfortably wherever you want to dial in from. This gives you the opportunity to receive knowledge on prediabetes, lifestyle change, behavior change, and then also we have some challenges that actually are fun and that actually give you the opportunity while you're in our classes, in our sessions, to make better lifestyle choices. Now, of course, we're going to work on goals, your progression. We're going to talk about what's working, what obstacles you may be facing. But in this Take Charge and Balance session, this is a community of like-minded individuals. It's a judge-free zone. You actually get the opportunity to be able to learn, to grow, and to input your opinions, your questions, your concerns, and we work together. If it's going great for you during the 12-week course, great. Share that. Let's talk about it. If you're having a hard time, not really understanding what you need to do next, that's what we're here for. I'm your coach. I'm a registered nurse. I'm a certified diabetes care and education specialist. So I am here to coach you through that. You're never alone. Our goal is for you to get the information and knowledge that you need during these 12 weeks. So as you continue your lifestyle, as you continue each day to day, even after you complete the class, you have the tools and the resources you need to be successful. Also offered throughout our program, we have 2 brand new ebooks. Yes, the Prediabetes Power Pack, where we talk about snack solutions, nourishing choices, and also activity. And then we also have Empowered Moves. Yes, where we talk about activity, movement. We address obstacles and barriers that you may face. Because there are going to be some obstacles, there are going to be some barriers, but guess what? Prediabetes management, lifestyle change, behavior change, it's a marathon. It's not a sprint. We work on it day by day by day. We see what works, what doesn't work, and we tweak it. We change it. We do what we need to do to make it work for your lifestyle. So I'm so looking forward to seeing you in our sessions. Take Charge and Balance for 12 weeks via Zoom, virtually, in our group session. And then also grab your ebooks. Empowered Moves, and the Prediabetes Power Pack. All the information will be in the links. Make sure you grab the information, share, comment, subscribe to this channel, share with your family, share with your friends, share with your colleagues. Let them know what you're learning, because guess what? Knowledge is power. I look forward to talking to you. Let me know any questions, drop them in the comments, and we will address them. Take care, and I'll talk to you soon. Until next time, bye-bye.